뭐야?
Oh no! Savage rock, paper, scissors, extreme bathroom brawls, and game time gone terribly wrong. In honor of the new season, today we're back for round 3, breaking down and reacting to all of the disturbing medical scenes and high stakes injuries from Squid Game. Spoiler alert, if you haven't seen Squid Game yet, these scenes might give some crazy stuff away. Watch at your own risk. Let's dive right in. Oh, nice hair. I did this once when I was in college, my freshman year of college. I dyed my hair the same color. Oh, it's got a tracker. The skin behind the ear here. There's not much tissue underneath. You have the skin, and that bone back there is actually your mastoid. Sometimes that can actually get infected, the bone, if you have really bad ear infection, and then you can get something called mastoiditis, which is actually quite dangerous. Oh, geez. Oh, come on. Come on. Oh, that's gotta hurt. Brand new razor blades are actually really sharp. We actually use tools in the emergency departments or in the hospital that are similar, like an 11 blade, but it's not sterile, right? So just be aware of that. Oh, I'm assuming this is quite painful. If I were to do this, you need to anesthetize the area, inject some lidocaine to it, numb it up so you can make it a lot easier. Other ways you can do, maybe you can use some ice to numb the area, but the numbing is gonna go away pretty fast.
여러분들이 하실 게임은 가위, 바위보,
Paper, rock, scissors, -1.
아시죠?
Oh.
두 손으로 가위바위보를 하고 하나만 빼서 남은 걸로 승부를 겨루는 게임.
We see a lot of trauma to the face, bleeding, bruising, different colors, and that does happen depending on the timing. Bruising starts out as more like red, then turns to like blue, purple, and then actually over time will turn to like a greenish yellow and then disappear. It just has to do with the breakdown products of the red blood cells.
이 권총에 총알 하나를 넣고 닫습니다. 그리고 지는 분 머리에다가 방아쇠를 당길 거.
Gunshot wound to the right side of the head, going straight across. You have the two hemispheres. If you hit it perfectly down the middle, there is a chance that you're not gonna have as much damage, minus the fractured bone particles from the front and the back. He sacrificed for his buddy. Oh, you're definitely hitting tissue on both sides, and then a lot of your major structures are actually deep within the middle section of our brains. We don't see that many gunshot wounds that come into the emergency department where it's directly to the side like that. Usually they're very angulated. If you're close up like that, you're gonna have gun residue, you're gonna have burns to the scalp. It's not gonna be as clean as it's depicted here in the show. But yes, the likelihood of survival is pretty minimal unless it was a blank.
지금부터 제가 하는 말 잘 들으세요. 이거 그냥 게임이 아닙니다. 게임을 하다
Oh
걸리면
no, remember in the first season, this is where you play red light, green light, 1, 2, 3. Oh.
뭐야?
Oh no! Anybody out there allergic to bees? Let me know in the comments. But I wonder if somebody were to be bitten and it went into like anaphylaxis or something, if they had medical care to help them during the game. I don't know. Do not move. Oh no.
다 움직였어.
Oh! Took a shot and direct hit to the head. That other guy got blood all over his face, definitely into his eyes, even into the mouth. Increased their risk of getting transferred of any bloodborne pathogens. The bloodborne pathogens that I'm talking about is like HIV, hepatitis B, hepatitis C. Those are the big ones. Oh, took a GSW to the upper part of the chest on the left side. Could hit the heart, could hit the aorta, which is like this big, massive blood vessel coming off our heart that literally supplies all the blood to the rest of our bodies. If you get a big hole through that, you're gonna bleed out really fast.
그거 하면 안 돼요? 저도.
장르가 정리될 때까지 잠시 기다려 주시기 바랍니다.
너 이게 뭔지 알아? 엑스터시.
Oh, that guy is using some illegal substances. Ecstasy is MDMA. It's a stimulant and a minor psychedelic, so people use it at like raves. Ketamine is a dissociative hypnotic, and we actually use that medication at the hospital for sedation.
이거 새로 합성한 거라 완전 crazy man. 너 간다 안 돼.
I wouldn't pop any of those suspicious pills, but if I was needing a little more chill in my life, I'd reach out for Chillax by my company, Life Happens. It's an occasional stress support supplement. If you want to learn more about Chillax, check it out at lifehappens.com or on Amazon. Okay. Oh, 10. Go. Go, 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 go. It almost feels like sometimes in the emergency department, a little bit of chaos happens often enough that people are able to control their emotions and get the job done. Oh. Get out. It looks like it's a different number, maybe number 2. That position can collapse the trachea, decreasing oxygen. You can collapse most of the airway down because the cartilage of the trachea is kind of flexible and it doesn't go all the way around except for one, your cricoid cartilage. You also have to think about the blood flow in and out of the brain. Oh. I don't see these type of injuries that come in. Somebody who has a high cervical injury where the autonomic nervous system is not active, so you're not breathing anymore and your heart stops. Does it happen that fast? Hard to exactly know, but probably pretty quickly. Oh! I can say I've never been punched in the face before. I've taken a soccer ball to the face, but getting punched in the face hurts. You're hitting your bone, but also hurts somebody else's hand. And we get very common fractures of people's hands called the boxer fracture. Oh, the bleeding in the mouth is the worst. Most likely 2 different reasons. Your mucosa on the inside hits your teeth and causes a laceration, or your teeth start getting loose and you start bleeding from the gums. Oh, he's trying to choke out. So it looks like most of the pressure is on the trachea. And actually you can see the lips are starting to turn blue here. Actually, really good depiction of it.
He's turning blue.
You're probably going to lose your airway soon, or you can actually cause a break of the cartilage. It bends a lot, but you can cause a break there. Or if it's high enough, there's a hyoid bone. You can fracture that as well. What happened? That was like a gooey, squishy noise. Oh man, a submental puncture wound with a fork underneath your mandible here. A lot of soft tissue here going straight up into the floor of the mouth. It's gonna cause some bleeding and pain, but it's not mortal. It's not gonna make you lose a lot of blood.
Should have gone for the head.
Oh my gosh. Okay, Squid Game Season 2. This looks really good. I want to know what the games that they're playing are the same games, because I see the first game's the same, but the other ones I didn't recognize. Let me know if you want me to react to more of the Squid Game Season 2 in the comments. And as always, definitely binge watch this playlist right here. And do me a favor, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.